Today we have Dr. Fugen Nezirolu, Director of the Biobehavioral Institute in Great Neck, New York. Dr. Neziroglu is a specialist in treating obsessive-compulsive spectrum disorders. Dr. Neziroglu, could you tell us a little bit about how you became interested in body dysmorphic disorder?
Sure. I got interested in body dysmorphic disorder as a consequence of my research in obsessive-compulsive disorder. The two disorders are extremely similar to one another. In both you have obsessions and you have compulsions, and I've been researching BDD, which is what we call body dysmorphic disorder, for about, I would say, a good 25 years or so. And it's really a very important disorder that many people don't know very much about.
What exactly is body dysmorphic disorder?
Body dysmorphic disorder is a preoccupation with a defect, or they call it an imagined defect, which is usually very insulting to patients who suffer with BDD because they really see the defect or feel the defect, but others don't see it. And if the defect is in fact there, it's so slight, so minor, that for the normal eye, it's non-existent. The individual obsesses so much about the defect, it interferes with their functioning, it really causes them an incredible amount of distress and anxiety.
Okay. What are the common signs and symptoms of body dysmorphic disorder?
Common symptoms of body dysmorphic disorder are obsessions, compulsions, what we call safety behaviors. Let me give you an example. The individual, for example, obsesses about their nose or their complexion or their hairline. They may obsess about a scar, wrinkles on their face, vascular markings on their nose, or any other body part. It usually centers around the face and hair, but it could be actually any part of the body. It could be the arms, legs, stomach, thighs, anything, back. It's a disorder that's trivialized by many people, but actually it's so severe. 80% of the individuals are suicidal, about 30% actually try to commit suicide, and a certain percentage actually are successful and do commit suicide.
How would you distinguish BDD from just, a general dissatisfaction with one's appearance?
Well, BDD develops around adolescence, which is a time where most people are very concerned about their appearance. And a lot of people do ask that. What's the difference between normal concerns or dissatisfaction versus BDD? If we look at adolescents especially, that are, as I said, it's a time where the individual is developing a sense of their body, and dissatisfaction regarding various body parts may actually occur, but it's very, very different than BDD. First of all, for the individual who suffers with BDD, it occupies at least 1 hour of their day. It's an arbitrary number that we assign, but it's about 1 hour or more per day. Many people could go and obsess about the body part for hours on end. Second, it interferes with their functioning. By that, what do we mean? We mean they don't want to go to school, or they don't want to go to work, or they want to go out only at night where the defect is not as visible. They check their appearance in the mirror continuously, or it gets to a point of such frustration they actually avoid looking in the mirror. So the amount of anxiety it produces, the interference with their functioning, are all aspects that are really very different from the normal concerns that all of us have.
Is this only something that women suffer from?
No, and that's very interesting because we usually think about body image disturbance as pertaining to women, and I think that myth comes from more of the eating disorder research. But reality is that it's one-to-one, and I actually have more males than females who come in to see me.
Thank you so much for the great information and for being with us today.
Thank you.